Hello, welcome to Women's Health and Fertility. I am Dr. Aniku, a gynecologist, and today we are talking about in vitro fertilization, commonly known as IVF or test tube pregnancy. Infertility affects millions of couples worldwide and can be emotionally, physically, and financially challenging. Fortunately, advances in reproductive medicine have made it possible for many couples to achieve pregnancy through assisted reproductive technologies such as IVF. In today's video, I will explain what IVF is, who may need IVF, causes of infertility, the IVF process, preparation before treatment, success rates, risks and complications, and lifestyle factors that can improve success. What is IVF? IVF stands for In Vitro Fertilization. The term in vitro means in glass, referring to fertilization that occurs outside the body in a specialized laboratory. Normally, fertilization occurs inside the fallopian tube when a sperm meets an egg. In IVF, eggs are collected from the woman's ovaries and fertilized with sperm in the laboratory. The resulting embryo is then transferred into the uterus where pregnancy can occur. Because fertilization occurs outside the body, IVF is often called a test tube pregnancy, although modern laboratories use specialized culture dishes rather than test tubes. What is infertility? Infertility is defined as failure to conceive after 12 months of regular unprotected intercourse in women younger than 35 years or after 6 months in women aged 35 years and above. Infertility may result from female factors, male factors, both partners, or sometimes no identifiable cause. Who may need IVF? IVF is usually recommended when other fertility treatments have failed or when it offers the highest chance of success. One common indication is blocked or damaged fallopian tubes. If both tubes are blocked, the sperm and egg cannot meet naturally. Causes blocked tubes may include pelvic inflammatory disease, previous ectopic pregnancy, tubal surgery, endometriosis, and genital tuberculosis. IVF bypasses the fallopian tubes completely. Another indication is severe male factor infertility. Some men may have low sperm counts, poor sperm movement, abnormal sperm shape, or no sperm in the semen. In such cases, a technique called intracytoplasmic sperm injection, or ISI, can help achieve fertilization. Women with moderate to severe endometriosis may also benefit from IVF. Endometriosis can damage the ovaries, affect egg quality, cause pelvic adhesions, and block fallopian tubes. IVF may also be recommended for women with ovulation disorders such as polycystic ovarian syndrome, premature ovarian insufficiency, or hormonal disorders when simpler treatments have failed. Other indications include unexplained infertility, advanced maternal age, and couples with inherited genetic disorders who wish to reduce the risk of passing serious conditions to their children. Preparation before IVF. Before treatment begins, both partners undergo a comprehensive fertility evaluation. For women, this may include hormone testing, anti-Mullerian hormone assessment, pelvic ultrasound, ovarian reserve testing, infection screening, and evaluation of the uterine cavity. For men, evaluation usually includes semen analysis, hormonal testing when necessary, and screening for infections. These investigations help determine the most appropriate treatment plan. The IVF process has many steps. First is ovarian stimulation. Normally, a woman produces 1 egg per month. During IVF, fertility medications are used to stimulate the ovaries to produce multiple mature eggs. The woman receives daily hormone injections for approximately 8 to 14 days. During this period, doctors monitor follicle growth and hormone levels using ultrasound scans and blood tests. 2. The trigger injection. When the follicles reach the appropriate size, a trigger injection is administered This helps the eggs complete their final maturation. Egg retrieval is scheduled approximately 34 to 36 hours later. Third is egg retrieval. Egg retrieval is a minor procedure performed under sedation or anesthesia. Using ultrasound guidance, a needle is passed through the vaginal wall into the ovaries to collect fluid containing the eggs. The procedure usually takes 15 to 30 minutes, and most women return home the same day for sperm collection. On the day of egg retrieval, the male partner provides a semen sample. The laboratory selects the healthiest sperm for fertilization. In some cases, sperm may be retrieved surgically. Fifth step is fertilization. The eggs and sperm are combined in the laboratory. In conventional IVF, thousands of sperm are placed around each egg, and fertilization occurs naturally. In ICSI, a single sperm is injected directly into an egg. This method is especially useful in severe male infertility when sperm count is too low. Step 6. Embryo culture. After fertilization, the embryos are carefully monitored in the laboratory. They are usually cultured for 3 to 6 days. The healthiest embryos are selected for transfer. Step 7. Embryo transfer. Embryo transfer is usually painless and does not require anesthesia. A thin catheter is passed through the cervix into the uterus, and the selected embryo is gently placed inside the uterine cavity. The procedure takes only a few minutes, and the patient can usually return home shortly afterward. After that is then the 2-week wait. This is often the most emotionally challenging stage of IVF. The patient takes medications such as progesterone to support implantation. Approximately 10 to 14 days after embryo transfer, a blood pregnancy test is performed. If the result is positive, an ultrasound scan is scheduled a few weeks later to confirm the pregnancy. In conclusion, IVF has helped millions of couples around the world achieve pregnancy and build families. Although the process can seem complex, understanding each step can help reduce anxiety and improve confidence during treatment. If you have been trying to conceive without success, consult a fertility specialist for proper evaluation and guidance. If you found this information useful, please like, share and subscribe to Women's Health and Fertility for more evidence-based reproductive health education. Thank you. This is Aniku.